This is a diagram to demonstrate the fallopian tube. It is formed of 4 parts. This part with the fimbriae closely related to the ovary. It is called the infundibulum, يعني زي الأمة, and a wide dilated part which is the ampulla, and the narrow part or the isthmus, and a part which is present inside the wall of the uterus. It is called intramural part, which is a very short part. And this picture demonstrates the mucosa and the musculosa. This is the musculosa and this is the mucosa of epithelium and connective tissue of the fallopian tube in the area of the isthmus. Here the histology of the fallopian tube. It is formed of 3 layers. Number 1 is the mucosa, which is formed of epithelium resting on connective tissue lamina propria. So we have here the epithelium, which is simple columnar, partially ciliated and partially secretory, and it rests on the lamina propria, which is nothing but connective tissue. Then we have the musculosa, formed of inner circular and outer longitudinal, and it is responsible for peristaltic movement to push the ovum, fertilized or not, towards the uterus. Then we have the peritoneal covering, which will be called the serosa, which is nothing but connective tissue, loose aerial connective tissue covered by simple squamous epithelium. Again, this is a section in the fallopian tube, and you will see here the lumen, the characteristic folding of the mucosa here. And here we have this pale connective tissue corium inside these folds, and then we have the muscle layer, which is darkly stained. And finally, we have the serosal covering of the peritoneum. Again, the mucosal folds, simple columnar, partially ciliated, partially secretory, connective tissue corium, and then the muscle tissue. And finally, we have the covering of serosa. The muscle is formed of inner circular and outer longitudinal, but we cannot see here the longitudinal bundles so clearly. Don't forget in this point the modifications that takes place in the different parts of the oviduct or fallopian tube. Number 1, the folds increase so much in the ampulla. Number 2, the ciliated cells اللي هي عليها السيليا هتبقى أكتر من secretory cells, more than the secretory cells in the infundibulum. طب number 3 and at the same time 4. Number 3 is the secretory cells. Secretory cells here, which produce the secretion, and the thickness of the musculosa are more in the intramural part. Again, don't forget the function of the fallopian tube. The ciliated cells, okay, we know that the beating of the cell, of the cilia, will move the ovum towards the uterus. But at the same time, we have the secretory cells which produce watery secretion. السكريشن هنا بقى watery، وأهم حاجة نعرف فائدته إيه؟ إن هو له nutritive function for the oocyte and also for capacitation of the sperm، عشان يقطعوا القدرة على الفرتيلايزيشن. capacitation. يبقى دي هي functions of the secretion produced by the secretory cells. This is a picture for the uterus endometrium. Here we have the endometrium, and this is the muscle tissue with the blood vessels in between. This phase is the follicular or proliferative phase or estrogenic phase. You have to remember the three names. Proliferative, as we have the proliferation of the endometrial glands. Follicular, because the ovary at this stage is showing the development of the ovarian follicles under the effect of FSH. Why estrogenic? Because these follicles produce estrogen, which is responsible for the changes observed in this stage. What are the features here that helped you to diagnose that it is the follicular? Because the glands here are straight. Here the glands are straight glands and with narrow lumen. And no secretion can be seen. With no secretion can be seen inside the lumen of the gland. What is the thickness of the endometrium at the end of this stage? It is about 2 to 3 millimeters. Mention other change that takes place in this stage. The blood vessels actually become regenerated again, but they are not congested. So we have a regeneration of the glands, a regeneration of the endometrium to return again to its normal form of simple columnar, partially ciliated, partially secretory, and in addition, of course, to the regeneration of the blood vessels. What type of blood vessels? The spiral arteries. Look here, this is the secretory phase of the endometrium, which is called luteal, because at this stage the ovary is showing the corpus luteum, or progestational, because it is under the control of the progesterone hormone secreted by the corpus luteum, as we have said, by the granulosa lutein cells. What features you can see here? Here the endometrial glands are long, very long. أول حاجة طويلة جدا. Also highly tortuous. مهم قوي إنه هي متعرجة جدا. Highly tortuous. وده معناها إنها full of secretion, denoting accumulation of the secretion, which is glycogen. Also, the thickness is so much increased. Here the thickness at the end of this stage is about 5 millimeters. 5 here millimeter in thickness. يبقى عندي زيادة في الثيكنس، عندي إن زيادة في الطول بتاع الجلاند نفسها، عندي tortuosity of the glands, denoting that they are full of the secretion, which is glycogen. Also, at the same time, the spiral arterioles are now congested. You may see here some congestion here of the blood vessels. Actually, it is present in the section, congestion of the blood vessels. This is the visible features here that we can comment on. Of course, we have other effect or other change is that the decidual reaction that will appear in the stromal cells. Here the stromal cells become enlarged. هتكبر في الحجم بتاعها اللي هو بنسميه decidual reaction. السيلز هتبقى very large in size and it shows features of protein synthesis that will be the rough endoplasmic and Golgi apparatus development. This is called decidual reaction and it appears in the stromal cells. But it is not evident in this slide as a practical exam. It's a theoretical point. Oh, this is a very nice picture showing the secretory or the luteal or the progestational stage where we have marked increase in the length, marked coiling and tortuosity of the endometrial glands, denoting their congestion or their accumulation or filling with glycogen. Also, you may notice here the congestion of the blood vessels here in this area. It is also present. And this area is the start of the myometrium. This picture is for the vagina. The vagina is formed of 3 layers. This is the mucosa from the epithelium till the start of the appearance of the muscle. So this is the mucosa. All of this is the mucosa. It is formed of the epithelium, which is non-keratinized stratified squamous epithelium, and connective tissue under this epithelium, connective tissue corium. Notice that it is very rich in blood vessels. Also, it is rich in elastic fibers. Then we have the musculosa. The musculosa is formed of inner circular and outer longitudinal. Here you can see فعلا circular fibers can be seen. Also we have blood vessels, and the outer longitudinal is not so evident. Actually the muscle is not well developed in this organ. And finally we have the fibrosa, because or the adventitia, because it is not covered by peritoneum. Here we have the epithelium, non-keratinized stratified squamous, resting on the connective tissue corium. Very important feature in these epithelial cells, under the effect of estrogen, these epithelial cells will form and accumulate a huge amount of glycogen. And when these cells of the surface desquamate, يعني تقع, fell down in the lumen, this glycogen will be present in the vaginal lumen, and under the effect of the lactobacilli, it will be converted to lactic acid, making the pH in the vagina is acidic, and this is a protective function against the fungi and bacteria. Fungi like Candida albicans also can be destroyed by this acidity. So it is a protective role in protection against these infections. Don't forget also that the alkalinity of the semen will neutralize this acidity so that the sperms will not die during intercourse. This is also a picture for the vagina. You can see the non-keratinized stratified squamous epithelium. The top cells, don't forget, accumulate the glycogen under the effect of estrogen, and it has a protective role. And then we have a wide area of the connective tissue corium, or areolar connective tissue, which is rich in 2 things, the blood vessels and the elastic fibers. This is a diagram for the structure of the placenta, where you can see the sections in the chorionic villi. In the center we have the fetal blood capillaries containing the blood, and we have the areolar connective tissue containing phagocytic cells, they have power cells, and then we have a basement membrane separating the connective tissue from the epithelium. Then we have the cytotrophoplast, where you can find the partitions or the cell boundaries, and at the most superficial you have the syncytial trophoplast, where we cannot find or see any partitions between the cells. They are in syncytium. And in between we have the maternal blood coming from the eroded blood vessels, so that exchange takes place between the maternal blood and the fetal blood through this wall. Don't forget that the cyto and syncytium are present in the first half of pregnancy, or the first 4 months of pregnancy. In the last 5 months of pregnancy, where there is a more need for the exchange between the baby and the mother, or the fetus and the mother. In the last 5 months, we have only the syncytial trophoblast. Here are the sections actually of the placenta. Here we have a section in the chorionic villi. All these are sections. Notice here the blood capillary of the fetus, blood capillary of the fetus, blood capillary of the fetus. These blood capillaries are present inside the chorionic villi, and on the surface we have the cells of the trophoblast. In between these chorionic villi, we have the maternal blood coming out from the eroded blood vessels. I think in this picture I cannot see a cytotrophoblast. I can see only the syncytial, so that if you are asked, suggest what part of pregnancy or what half of pregnancy is this placenta, you will say it is in the second half or the late 5 months, because I can see only the syncytial trophoblast and I cannot see the cyto. This is the connective tissue. This is a picture showing the mammary gland in resting stage, which is non-lactating, and in the lactating stage. Of course, in the resting, you can see that we have the lobes containing ducts only, no secretory alveoli, and they are separated by thick connective tissue septa, which are very rich in fat cells. If you are asked about the lining of the ducts are lined by simple cubical epithelium, and it is surrounded by myoepithelial cells. This as regards the ducts. And then it is changed into lactiferous sinus. Here we have a duct, and we have a dilated part called lactiferous sinus, and then a terminal part that will open finally on the surface. So the duct is formed by or lined by simple cubicle with myoepithelium, while the lactiferous sinus is lined by stratified cubicle. And then at the opening or at the terminal part that opens on the surface of the skin, it is like the skin, it is stratified squamous. يبقى التشينج في الدكت لايننج يبدأ بسمبل كيوبيكل زي معظم الدكتس معاها مايو ابيثيليال سيلز. وطبعا ما تنسوش المايو ابيثيليال سيلز دي شفناها في كمان في الساليفري جلانز. After that it changed to stratified cubicle at the lactiferous sinus, and finally it opens by stratified squamous epithelium on the skin. Then look at the lactating mammary gland. You will see here how far the change in the shape. Here we have the septa are much reduced, the fat cells are much reduced, and we have, in addition to the ducts, we have the secretory alveoli. By higher power, we have these alveoli are filled with the milk. Notice the milk here have some white spaces denoting dissolving of the fat present in this milk during preparation of the section and the use of alcohol. If you are asked about the lining epithelium of the secretory alveoli, here we have the secretory alveoli are lined, and actually this lining depends on the activity actually, but most commonly it is lined by simple columnar epithelium, of course with the basal oval nuclei. So this is the lining of the alveoli. The milk appears vacuolated due to the dissolving of the fat during preparation of the section. The EM picture here is very nice because it shows the features of protein formation and lipid formation. So it has a well-developed rough and Golgi, a well-developed smooth mitochondria and lipid droplets. Here is a picture for a lactating mammary gland, denoting here the milk secretion inside the secretory alveoli. The secretory alveoli are very numerous here, and we have the ducts. يبقى الالفيولس اعرفه بالسكريشن والدكت ما فيهوش يعني السكريشن يبقى واضح قوي، البينك كلر ده ما يبقاش باين قوي في الدكتس، بيبقى باين اكتر في السكريتوري الفيولاي. وان الكونكتيف تيشو trabeculae are much reduced and also the fat cells are much reduced. Here we have the dilated alveoli and these we have the ducts. As you see here, we have the secretory alveoli lined by, actually in this picture, they are lined by cubical epithelium, but the most common, it is simple columnar, and actually the lining depends on the activity of the breast. Here we have the milk secretion inside the alveoli. Also, don't forget that myoepithelial cells are present around both the secretory alveolus and the duct. This is the first slide in the trial exam. Number 1, identify the organ, ovary. 2, identify the entire structure indicated by the arrow, this arrow here. This structure, the whole structure, is the secondary because we don't have still a huge one cavity, so we have still multiple, and so it is with the secondary follicle. Number 3, identify the cell type indicated by the tip of the arrow. Here the arrow was in this area, so this is a 23, and the cell type is a granulosa أو follicular cells. Number 4, identify the structure indicated by the arrow. This is the primordial follicle because it is formed of the primary oocytes surrounded by flat simple squamous epithelial cells, so this is the primordial follicle. Number 1, identify the region of the organ indicated by the arrow 37. This region, of course, it is the myometrium. Number 2, identify the region of the organ indicated by the arrow. This is the endometrium, of course. This is the endometrium. In the zone starting from the epithelium till the start of the myometrium, so this is the endometrium. Number 3, identify the tissue indicated by the arrow. It is the endometrial stroma formed of loose connective tissue. Number 4, identify the structure indicated by the arrow. It is an endometrial gland. Number 1, identify the organ, ovary. Number 2, identify the entire structure indicated by the arrow, the whole structure, it is the secondary follicle. Number 3, identify the layer indicated by the arrow, it is the theca interna. Number 4, identify the structure indicated by the arrow. This is, of course, a unilaminar primary follicle. Number 1, identify the organ, fallopian tube. Number 2, identify the tissue indicated by the arrow. This is the smooth muscle of the musculosa. Number 3, identify the entire structure by the arrow, mucosal fold. Number 4, identify the layer at the tip of the arrow. If I have this arrow, this is the lamina propria or the connective tissue column. Number 1, identify the organ, ovary. Number 2, identify the entire structure, Graafian follicle. Number 3, identify the structure indicated by the arrow. This is the unilaminar primary follicle. Number 4, identify the structure indicated by the arrow, secondary follicle. Number 1, identify the structure which fills the field, Graafian follicle. Don't forget double A. Number 2, identify the cell type indicated by the arrow, granulosa cells. Number 3, identify the layer, theca interna. Number 4, identify the space, antrum. Identify the organ, ovary. Identify entire structure indicated by the arrow. This will be a multilaminar primary follicle. Number 7, identify the cell at the tip of the arrow. Number 7. Here the arrow is towards the same structure here. So identify the cell at the tip of the arrow. This is the primary oocyte. Number 4, identify the layer indicated by the arrow, theca interna.